Okay. Good morning, everyone, and welcome. We're really pleased to have you join us for this morning's presentation. We're going to be talking about the Veteran Liaison Project, Expand Veteran Liaison Project. This is something that we're partnering with Union Community Health Center to really think about how are we engaging with veterans, how are we promoting the appropriate services that veterans need. We know that this is a population that is, I think, well underrepresented in our official counts of who we serve. We know that there are a lot of veterans that are coming into community health centers, but we may not be identifying who they are. So we really want to make sure that we're thinking about how are we addressing the needs of the patients that we serve, especially for this group that may be unidentified, that may go unidentified in terms of the work what we do, but really has some specific needs that we can really think about how we're best addressing through community health centers. So I'm very pleased to introduce Dr. Douglas York. He's the CEO of Union Community Health Center, who's going to be talking about this project, who we are partnering with. Chicanes is very pleased to partner with Union around this project. He's going to be talking about some of the work that they've done and what the next steps are and how community health centers can be involved to really advance the work that we're all doing to serve our veterans. So with that, I'm going to turn it over to Dr. York.
Thank you, Rose. I'm very pleased to share this opportunity with our fellow FQs in New York State. So I will share my screen and we'll get started. Once again, good morning, everyone. This Veteran Liaison Expansion Project, it stems from a grant funded by the New York Health Foundation. Union received a grant from the New York Health Foundation to create something called the Veteran Liaison in our community a few years back. Based on the success of that, we were able to propose an expansion of this statewide so other FQs could learn from this experience and hopefully be in a position to formulate a similar type of liaison in their health centers, in their communities. Today, I'm going to share with you the substance of the grant, how you can all participate, and I'm very pleased to have with us today, of course, Rose, who is our president at Chicanes, but also Dr. Denise Tahara. This grant is jointly funding work by Union, Chicanes, and Pace University. Dr. Tahara, who is the chair of the Department of Health Sciences at Pace, and her academic group and students would help us with data tabulation, collection, and focus groups. So with that, I'd like to get started and take you into the substance of this particular project. And we're not advancing. Stand by, everybody. There we go, everybody. So at the conclusion of today's webinar, all of you should be able to identify if the community that your FQ serves will benefit from participation in the Veteran Community Care Program, which is actually the structure by the VA from a clinical and financial perspective that allows veterans to access health services in your community. Number two, we'd like you to be able to determine if you have the resources to identify available services in your community, or you're starting from scratch in terms of figuring out what is available to veterans in your community within the VA nearest you and outside the VA to see what type of service gap they need and maybe your FQ could fill. We'd also like you to have enough information to decide if you wish to participate in this Veteran Liaison Expansion Project focus group system, of which there are two. There are focus groups for FQs themselves, and then focus groups for veterans in your specific community. The problem we're having, and so many of you are aware of right now, is that veterans continue to face barriers with regard to receiving timely and quality healthcare services within the VA system, within the local VA near you, and in the community at large. Our experiences indicate that veterans still wait for PCP referrals and specialty referrals, often over 45 days, leading to great clinical concern by all of us as providers and great frustration to our veterans. Our veterans face continued administrative burdens with regard to navigating referrals, authorization, documentation, and eligibility for claims. Our veterans continue to present to us, through our existing veteran liaison, challenges in navigating social support services in our community related to housing, legal, employment, and other types of initiatives that even though our VA is very, very strong, does not fulfill that care gap, which our veteran liaison has been doing. There is also a lack of education and awareness around veteran cultural competency, unique issues that veterans encounter when they access healthcare and social system services that need special consideration and training. Our EHRs do not consistently identify veterans, those who have served within our electronic health records, as there is no standardized format for collecting information. This has historically led to undercounting and underrepresentation of our veterans, thereby not properly representing the great need that they have, as the numbers are stronger than our UDS data would indicate. So the key deliverables and objectives of the process of this particular grant, again, we're stemming off of a single grant funded by New York Health Foundation to Union to create a veteran liaison in the community. We are looking to expand that statewide. We'd like to have our objective of expanding healthcare access for veterans through community-based FQHCs as extensions of the VA that may be near you or the closest one geographic. We'd like to develop a standardized, culturally relevant training curriculum for FQHC providers to address the unique needs of our veterans. The key deliverables of this particular project would be to conduct focus groups first with FQHC leadership to understand their level of participation in the VA system right now, and with veterans in that local FQHC community to understand what they need. Veterans issues sometimes are similar across the state, but we appreciate there are geographic and demographic variances, and we want to better understand that. We'd like to develop a training curriculum for FQs to better serve the needs of veterans in a consistent, culturally competent way. We'd like to tabulate the data from all of these focus groups, analyze it, share it with all the FQs, so we would be in a better position to develop policy and legislative action items to improve healthcare and access for our veterans. The process for this would be to conduct focus group with stakeholders. First group of focus groups would be with FQHC leadership to understand their current level of understanding of what their community-based care role can be, how they've navigated the veteran insurance system so far, or for those who have had no experience with this and want to enter that space. Second group of focus groups would be to administer surveys to veterans to identify their access and service gaps. Finally, we'd like to utilize the data to develop training materials and inform state and national policies. So before we move on, we'd like to take a brief poll here. So Liliana, we'd like to start with a poll here where we could better understand some basic issues around all of the participants in this group. Liliana, would you launch the first poll, please? Question number 1, is your FQHC part of a veterans community care program? Single choice, yes, no, or unsure. And question 2, is there an underserved veteran community in your service area? Please feel free to answer now. Okay, we'll give it another minute, everybody. So as we have a majority of our participants today reporting, we see there's still uncertainty. Okay? Many of us don't actually know what we participate in. It's that unclear and often that muddy. So we have some that say yes, some say no, and some unsure. Pretty much an even split, showing there's a lot of opportunity here. We do have a majority saying there is an underserved veteran community in your individual service area. Very important point as we move forward. Thank you, Liliana. Okay. Moving on to continue our presentation. So what are the opportunities for our FQs in our particular area here? Vets by the numbers in New York State. Let's take a look at this, everyone. The most recent data in 2022, New York State has approximately 676,000 veterans. There's some great geographic distribution of this, with the largest numbers appearing in the 5 counties listed there. However, throughout New York State, we see large pockets of veterans in need of health care. Now, back in 2017, there was a utilization study of how many veterans were enrolled in the VA health care system. And we saw that it was only about half, 58%, visited a VA healthcare facility during the year. As a result of the total, only 29% received their healthcare within the VA system. Further looking at that data, 50% of New York State veterans prefer receiving their healthcare outside of the VA system. And a RAND survey found that 2/3 of post 9/11 veterans have health insurance outside of the VA. This uncovers several care gaps here, just in the percentage of veterans who access the VA system, those who prefer to get their health care outside of it, but yet those who have actually been able to access health care outside the VA system. This is a significant opportunity for us and only highlights that there are underlying clinical care gaps that the FQ system can address. So what are the opportunities here for us in a changing regulatory and political landscape, everybody? The evolving landscape allows FQs to play a larger role in providing veteran health care. FQHCs can supplement VA services by offering accessible community-based health options. The Mission Act of 2018 did allow for community-based providers, and Union, in conjunction with several other large FQHCs and chicanes, worked aggressively to get language in the Mission Care Act to position FQs to be able to serve veterans. Unfortunately, since that time, we found that it has not been operationalized. And the language in that bill that allowed for this has not materialized into VA referrals or the ability for healthcare organizations, and specifically FQs, to offer veterans healthcare. FQHCs are well positioned to address care gaps in veteran care by our traditional foundation mandate of serving medically underserved populations. We're looking to a call for action to encourage FQHCs to build upon our mission and work to capitalize on changes that were in the Mission Act, and we want to continue to explore and hold that legislation accountable to expand services and partnerships to serve our veterans. So some brief background on the Veteran Liaison Project. This was an initial grant funded by the New York Health Foundation. It stems from the history of the Mission Act, passed in 2018, which was designed to improve and strengthen access to healthcare for veterans through the Veterans Community Care Program. It allowed for community-based providers to be extensions or extenders of the local or regional VA system. The role of the FQHCs was that we would be key providers in the VCCP network, offering primary specialty care, including mental health services. The idea would be that participants would be able to identify if there was services in the community not being provided, and you could fill that gap. That has not been operationalized. The resource identification is that participants would have the resources to identify available veteran services in the community they represent. That is what our Veteran Liaison in the first pilot project did. Identify care gaps, work with veterans in the community to develop a coherent list of what they still needed, and despite legislation in the Mission Act, were not able to access. Within our particular initial Veteran Liaison project, we identified participants with a need for increased access to healthcare for veterans. And we walked away with some significant gaps in healthcare that we believe, if further identified throughout the state, will provide FQs with a strong argument as to why we need additional expansion of services. We encountered several continued access barriers for veterans. Veterans themselves were not aware of the Mission Act and how it did offer alternate care options outside of the VA system. We continue to realize that our electronic health records did not capture veterans or those who had served in a way that might make them eligible for benefits. We did not find that local VAs were communicating alternate care options to veterans outside their system, even though it was documented in the Mission Act that the eligibility was there to do so. We found through our experience of our Veterans Liaison that when referral options were available, the VA providers themselves were either unaware or, if aware, did not have the tools to initiate a referral directly to an FQHC. We continue to find that veteran wait times for PCP and specialty appointments at our local VA often surpassed 45 days. And I will give great credit to the Bronx VA, everyone. We have an excellent VA system here. This is a structural, organizational policy issue that did not trickle down from the legislation to the VA, and our offline data says that is happening everywhere. We saw great experiences, negative experience, especially with our female veterans, who, although living locally within close proximity to a union location, were referred geographically far away, often 30, 40 miles from their local neighborhood here, and given excessive wait time appointments for first trimester care, prenatal care, and other types of related issues of great concern to us clinically and from a social justice perspective. Our project liaison, our veteran liaison, continued to find that veterans were overwhelmed by the administrative complexity, the authorization, the medical documentation, and claim revenue cycle. Our veteran liaison spent a great deal of time working on basic IT literacy and competency issues with our local veterans who could just not figure out how to access a portal, who could not navigate system, and were not in a position to engage through either issues related to their service or other limitations with the gatekeepers and those who were supposed to help them on the VA side. The veteran liaison at Union engaged in 4 key functions. Community advocacy. The veteran liaison at Union attended all community board meetings, attended veterans events, health fairs, and other related events sponsored by our local elected officials to be a veteran-only representative of a healthcare organization here. Veterans engaged with our veteran project liaison on a multitude of issues, not just healthcare. We found that the needs are so great of barriers, not dissimilar from our population that we serve, but much more complex, that they were still wrestling with navigating a different healthcare system in order to access services. Insurance advocate and resource, our veterans liaison spent a great deal of time being the conduit to our local VA or national VA databases and call centers to help them access coverage. A significant number of veterans are not aware that they are actually eligible for benefits. I want to repeat that. Many veterans do not understand their eligibility factor. There are different categories of discharge and service, and many are not unaware of how that correlates to a benefit. The veteran liaison spent a great deal of time doing that. We always wanted health services at an FQ to complement existing services, fill gaps. This is a non-competitive position for FQs. If they are finding that veterans-based services at the VA are at capacity, we would supplement that. If a certain VA facility does not offer services, then we would complement that. And that has been presented to our local VA. FQs are in a great position to do that. Our veterans liaison was there to address multiple challenges. I mentioned the digital literacy issue. This cannot be overstated as a problem. Okay. We had veterans coming in here who sat with our project liaison to go through the veterans portal to understand how to navigate their systems or to enroll them in some basic digital literacy classes and training so they could understand the importance of how they could be their own best advocates and get help for themselves when they need it. We believe the goal was to focus on reducing barriers and improving access to care, subsequently improving health outcomes. Additional insight from our experience with the Veteran Liaison Project is technology access. I've covered that. Service gaps. 4 key service gap areas were identified in the Bronx where veterans did not get access to services: mental health, dental care, physical and occupational therapy, and audiology. Those 4 areas were the ones that were in most demand by the veterans that our veteran liaison engaged with. Therefore, those are the 4 areas where we want to focus on legislative benefit improvement to be sure that veterans can get care in those areas, or at least in the Bronx, that those are the ones most presented most frequently. Through your participation in this pilot project, we'd like to know if those are the 4 similar areas that are in most need around the state of New York, or if there are additional ones. And your participation in this project will help us uncover that. Our veterans continue to experience long lead times to access care, and the complex referral system is something that challenged our veterans every day. We found that our veterans liaison continued to get questions and provide assistance in relation to housing, environment, resources, and mental health. Because veterans have a unique system they must follow to get housing assistance, legal assistance, there are not as many support systems around as a traditional FQH patient where the entire city or town infrastructure is built around supporting those services. So our veterans liaison worked with veterans consistently on these other social determinant of health issues. The veteran liaison successfully leveraged community relationships to connect veterans with broader support networks, where with legal, housing assistance, educational assistance, or employment assistance as well. The veteran liaison did that. By positioning the veteran to address those issues, they were in a better position to navigate healthcare. We saw a significant impact among the veterans that we serviced. And again, a lot of them did not utilize union for healthcare because of the continued lack of authorization by the Veterans Care Program, even though it's in the legislation. But we see the continued need, and we want to continue to address that. We were very pleased with the relationships that our veteran liaison formulated with veterans in the community, even to the point when we were doing a signage change outside of our building and updated our signage, we actually received many emails and calls concerned that we had removed the Veterans Resource Center sign outside our building, and it was just being updated and changed. So we did start to see a community dependence upon our services here. In the Bronx, we have 60,000 veterans in need of care. So the methods and approach to your participation in this project: we will formulate focus groups with FQHCs to determine their current comfort level engaging with the Veterans Care Coordination Network. And we will break that down based on your experience with the network so far. The focus groups will be separated into those who are part of the VCCP network and those who are not. A second round of focus groups will be done with veterans in your community. Once you agree to participate and you sign on board, we will then provide the resource and the content to be able to facilitate and work on a focus group with your veterans. With support from students and faculty from Pace University, we will be able to develop a standardized data collection tool and mechanism to be able to tabulate and collect data. There is no compensation for this. It's part of our continued work here for working with veterans. Chicanes has a coordination role, and Pace University is allocating resources to do this as well as part of the funded grant, but participants in the survey at either end will not receive any compensation. The questions for the initial surveys will be organized into 3 categories: access and availability of care. We want your FQ and your veterans to identify gaps in the availability of healthcare services for veterans. We want to understand how effectively care is coordinated or not between providers and communicated to veterans. We'd like to understand and tabulate what are the areas of advocacy that we need to collectively move on with the support of Chicanes and then through NAC at the federal level to better advance care by FQs in New York State. Our expected outcomes and milestones: the objective of the project is to expand the Veteran Liaison framework originating at Union with an initial grant from the New York Health Foundation across the state to better provide a training curriculum and a conduit to veterans in your community to support care needs for them, and then do a collective advocacy effort for veterans in New York State that can be translated into a policy request and legislation to be sure we're working to advance the needs of our veterans. In conjunction and collaboration with Pace University, develop a curriculum as a result of what we've learned in focus groups and surveys to inform the broader development of a training curriculum aimed at specific FQHC engagements with veterans. Driving policy, legislative design, and decisions is a state and national goal, and we're looking to complete our data collection and surveys in Q1 2025, and then subsequently share our data with all participants by May of 2025. So the next steps for everyone, we have 3 focus groups scheduled right now. These are for the FQs, not for the veterans. These are for members, your staff, your leadership, those who can discuss in 3 focus groups their interest, their level of engagement with the veteran care program right now. Focus group number 1 is Tuesday, December 17th. That's open to any FQ that wishes to participate, whether you've had experience in the veterans care space or not. Group number 2 on January 7th is for those who already have a contract with the Veterans Insurance Program. We want to hear your experiences and understand what your levels of concern are. Group number 3 are those who've had no experience with the Veterans Insurance Program. 3 senior team leads here from Union: John De Carvalho, our VP of Government Affairs, Dean Bertone, our VP of Finance, and Emily Pring, who wrote the original grant for veterans, our grants director, will help facilitate those groups to be able to facilitate questions and answers, and then with support from Pace University, we will continue to collect data and tabulate the findings of that. With that, we'd like to launch one more poll, please, so we can get an understanding about your interest in participating in this. So if everyone would please fill out this latest one. Give it a minute. This is encouraging, everyone. Thank you. It looks like we have a majority that wish to continue to participate in this project, and that is very exciting, so I appreciate that very, very much. We will, good numbers there, everybody. So what we will be doing is we will still reach out and encourage additional participation outside of those who've participated on this webinar today. Chicanes will help us send the recording out to FQs so that others may be able to gauge their interest and register for these groups that are upcoming. So with that, I also have here contact information for our grants director. Emily, if you would put that in the chat as well, I think that would be very helpful for people to be able to contact you with specific questions. Chicanes is a resource, and we're very excited about this. So with that, I think we can take some questions. If anybody would like to either put, there are some questions in the chat already here. Let's see if we have anything. All right, I think we have, we've answered several of these questions right now. So any questions that anybody has, we will distribute the recording. And Liliana, do you want to talk about the mechanics of registering for the groups themselves? You did put the registration link there for group number 1. Everybody, please note that in the chat as well.
Yes.
Hey, Doug.
Oh, go ahead.
No,
Yes.
no, go ahead.
Okay, so thank you. So Dr. Tahara from Pace University, we want to be sure that we'd like to get everybody to yes, if possible. Thank you, Dr. Tahara. So please do ask questions. Remember, if you're unsure, we encourage you to join one of the groups anyway, take it to the next level and be able to hear more and decide if this is something that you believe is in the best interest of your organization and your veterans, as we've identified underserved veterans in every community. Emily Pring's contact information is in the chat as well. So please do reach out to her with questions that you may think of offline. Any other thoughts? Rose, did you like to make any comments here? We want to be mindful of everybody's time.
Dr. York, I know Mary had a question. Mary, you want to go ahead?
Mary,
Yeah.
please.
Yeah, I do. Well, I have a thought. So we at Finger Lakes, we've always tried to ask the question, are you a veteran, right? Well, we weren't very good at it because it was hard to track and, turn over. But last year we really focused on it and we changed how we asked that question. And our numbers went up. We found that we were serving a lot more veterans than we even anticipated. So I think that maybe what would be really interesting if we could get, maybe Chicanes could help with this, somehow get us to the point where we all are asking the same question. I did a webinar with Gina Capra on this, how we were able to do that. But I think that if we all asked, I think we'd all be really surprised at how many veterans we actually serve. I don't think we know. We didn't know.
Mary, that's such an important point. Thank you. And we struggle with that at Union too. We installed the new electronic health record and we were insistent that the question be asked in the data system in a very specific way, and they couldn't do it. And we find that there is no standardization across EHR templates. And I believe that's an excellent policy legislative issue that we should get pushed through, that it must be asked in a standardized way. So to Mary's point, we will probably utilize some of our data collection with all the FQs to see how you are currently asking the question. And we do have language that we would propose to do that. So thank you, Mary. We will absolutely do that. Dr. Tahara, comments?
Yes, thanks, Mary, for your comment. Could you share with the group what you did differently that had some impact? I'd just be curious,
Sure.
because that's remarkable. So congratulations.
I'll send it to Doug.
Great.
Because I'm on
Thank
the
you.
phone. I
And
can't.
I will
Oh,
certainly
right,
send that
sorry.
out.
Okay, sure.
Yes, thank you very much. We will do that. Okay, everybody, I think we wanted to keep any other questions? We so appreciate your time today. This is a very important issue, and as part of our overall mission of our FQs to identify and develop customized, culturally competent training and educational curriculum for our patients. This is a path we want to go down. We'd like you all to come with this journey with us. While we do this, we are most appreciative to the New York Health Foundation for certainly understanding this issue, and certainly their Director of Veterans Affairs, Derek Coy, who has been an absolute champion in this space, and this work could not be done without his support and that of the foundation. We're excited to work with Pace University and Chicanes on the next step of this. So we will send out the recording. We look for participation in this, and we're very excited to see you down the road with this in the upcoming focus groups. And please, please join us on this journey together to improve veterans' healthcare. Thank you very much, everyone.
Thank you.
Thank you.
We'll be sending all the materials and make sure following up email for the registration for all the focus groups. Thank you so much.
Thank you, everybody. Have a
Take
good
care.
afternoon.
Thank you.
Bye.